Hello everyone, I just wanted to give you a little update on what's going on. I went to the emergency room on Saturday the 8th of July because I was having a lot of pain and muscle spasms around my hips and my sacrum. It was increasingly more difficult for me to actually just sit down normally. And I was fighting it all morning. I was knew that I was thinking about going to the emergency room, but I was like, seriously, do you really have to do this? And I just kept feeling pulled to go. And, because in my mind, I'm thinking you're going to pelvic floor physical therapy, you're doing everything that you're supposed to be doing, and you should be fine. But I was freezing. I was under a couple blankets for several days. I would come home from work in the past couple weeks and just tell my husband, listen, I have nothing to give. I'm running on empty. It was taking everything I had just to get through work and try to focus. And like I said before in another video, I was missing some of my IVs, and sometimes it was just hard for me to think because I was in so much pain. And then so I go to the emergency room. I have my in-laws take me, and my favorite part was there's a couple actually, but I go up, I had 2 blankets wrapped around me. I was in my house slippers because my house slippers always make me really hot. So I was like, I'll put those on. Those will at least warm my feet. And I walk up to the desk, and the triage nurse is like, well, you look really cozy. What can we do for you today? I was like, I am not cozy. I am freezing. I was like, and I'm having, I said, I think I'm having maybe a colitis flare. I said, I have a history of colitis. I don't know if it's back or something's going wrong. And he was like, oh, abdominal pain, nausea, vomiting, bloody diarrhea. And I was like, no, I'm actually having fevers and joint aches, my wrists, my ankles, every joint in my back. Muscle spasms, and I said I'm having rectal spasms, and his face was like, rectal spasm, never heard that for colitis before, but again, I don't know what's happening. So I get into the ED, they start an IV, they draw a bunch of labs. The nurse, as soon as I walked into the emergency room, he was like, are you always this pale? And I was like, I'm never pale, actually. I said, I often get asked by a lot of white people, what I am. They're usually confused by my ethnicity because I'm a little bit darker than most white people. So, and we all laughed, and it was funny, but, they drew a bunch of labs, and they told the doctor, or he told me the doctor was going to come in and give me an exam, which meant he was going to, check out my butt, and I was like, go ahead, everybody else has been in there. That's what pelvic floor physical therapy is. They're in there, every week, and I don't care, and it's also part of the gynecology-oncology exam. They make sure that you don't have any tumors growing, in your rectum. So, because that's the typical spread of ovarian cancer. It'll go to your colon and your peritoneum and your omentum and your digestive system first. And so, the doctor came in, asked me some questions. I got a CT. CT came back normal. I did have a mild fever, 100.7. My joints were really achy, and I just felt generally very unwell. They drew blood cultures to make sure I wasn't having, any kind of sepsis or anything like that. They drew my general labs, which would be a complete metabolic panel and a CBC and a CMP. And so in there, they found my hemoglobin. And my hemoglobin, I'm on a medication called Lynparza. I'm going to be on that until March of 2024. And that can mess with your labs. It's made me appear anemic, lack of red blood cells, but my hemoglobin was always kind of, 10 or whatever. It's still a little low, but 12 would be normal for women. That'd be the lowest normal for women. Mine was about 10, but that's expected with the Lynparza that I've been on. And he came back, and the nurse came back in and was like, "Hey, you remember how I said you looked a little pale?" And I was like, "Yeah." He said, "Your hemoglobin is 5.7. I was like, "What? 5.7? What?" I was like freaking out because below 8, we usually transfuse. We can start giving blood transfusions below 8. And I was like, where is my bleeding? Where is it going? I had no idea how I could have lost blood like that. And so they were like, well, we're going to give you a blood transfusion. I'm like, well, yeah, you are. I already know that. I'm like sitting there and I'm like, I'm going to get a blood transfusion. Just shocking, just completely shocking. And the next thing they do is they draw a lab called a type and screen. They want to know what type of blood you have. There's different types of blood. There's A, B, AB, and O, and each of those have positive and negative for Rh factor. Rh factor is just a receptor that is on your blood cell, and you have to get, the correct type of blood so that you won't have a reaction to it. If you get, say you're A negative and they try to give you B blood, that's gonna be bad for you. So they want to make sure they give you the right type of blood. So I'm A negative. So they come in and they start the units or whatever, and the doctor comes back in. This is another one of my favorite parts. The doctor comes back in, and he's an interesting doctor. I've never seen an ER doctor like this. He's very dry, very like, okay, bye, kind of a thing. He comes in and he's like, did you hear about your hemoglobin? And I was like, yeah. He said, did you expect that? I was like, no. And then he's like, yeah, me neither. And he just turned around and left. It was so funny. It's just like, what kind of response is that? And, the CT came back and it was normal. Nothing was abnormal in my CT. And then I'm like, well, colitis would show up, wouldn't it? And the GI doctor that came to see me said, well, maybe it's the beginning of it and it's not showing. And I'm like, I guess. And I was like, but I also don't have abdominal pain. Like I don't have the, same kind of pain that I had before, but I did have arthritis and, feeling like I had arthritis, the joint pain and fevers the last time that I was diagnosed with ulcerative colitis. So I thought that that's what that was. And then, so they started the blood. I started feeling better immediately with the blood. I was not expecting that. That's why I was so cold. I was also very thirsty, and I just couldn't quench my thirst, and I stopped being so thirsty after I got the blood. And then I got admitted to the unit. On the unit, we started bowel prep that night. I was going to get a colonoscopy on Sunday sometime. Probably, I think it ended up being 4 p.m. So when you do bowel prep, you have to be on liquids only until midnight. And then after midnight, you can't have anything except for sips of water with medications. So that night, and I hadn't eaten since 11. And I just had pops. I was so thirsty. I was like, I want popsicles. I have grapes, things that I thought were going to quench my thirst because the water wasn't helping. And so that's the last thing I ate. So I do this bowel prep, and I knew it wasn't going to go that well because I can tell when I just felt like the stool is just right there and I can't get it out. It's constipation. So I start the bowel prep, and before I did that, I told the nurse, I was like, I'm probably going to cramp all around my back and my hips, and it's going to be excruciating. I've done some of this at home already to clear myself out, and that's what happens. So she pre-medicated me with some Dilaudid. I'm allergic to morphine, so I had Dilaudid. Dilaudid is 5 or 10 times stronger than morphine, but they'll just give you a smaller dose of it. So she pre-treated me with Dilaudid. They switched shifts. I had a new nurse now. I'm going through this bowel prep, and I am in excruciating pain. This Dilaudid is not touching it at all, and it's because I can't get the poo out. My body is trying to force it out because of the bowel prep, and it's just my sacrum is feels like it's gonna pop off. My hips are just in excruciating pain. I'm trying to walk to the bathroom, and I can barely get there because when these spasms happen, my legs won't move. I can't move my legs. They don't work properly because everything's in a spasm. So that was fun. And then once I was able to pass some of that more solid stool, everything was much better, and it was just coming out like, as you would expect. But during that first couple, 2 or 3 or 4 episodes of trying to go to the bathroom with the bowel prep, the nurse was like, I'm going to see if I can get you another dose of Dilaudid or like something else for pain or something. And they ended up giving me another dose of the Dilaudid, and it like sort of kind of helped. It didn't really help that much. So that's how much pain I was in. Like Dilaudid wasn't even touching it. It was excruciating. But I eventually got, clear. And then I had to wait all day until 4 p.m. to go get my colonoscopy. So I go to get my colonoscopy, and I wake up, and I heard the nurse say stricture. And I was like, I have a stricture? And she's not supposed to be the one to tell me that, but I overheard her say that. She probably thought I was still groggy or something. And so she said, yes, you have a stricture. And I was like, okay. I was like wondering, is it at the site of the anastomosis? And if you've watched any of my videos before, an anastomosis is, in particularly to my case, I had tumor in my sigmoid colon. Your sigmoid colon is right before your rectum. And then your rectum leads to your anus. So it's like sigmoid, rectum, anus, and that's how your poo comes out. Well, I had tumor in my sigmoid, so they removed my sigmoid colon, and they reattached my colon to the rectum. And that is called an anastomosis, when they reattach a piece of a tube of some kind. It can happen anywhere in your body, but your colon is a tube that the stool moves through, and then they reconnect it. And like all your blood vessels are tubes. What else is a tube? You have like different ducts and things that your lymphatic system is going to be tubes. They're going to be tubes that carry liquid or particles, or in the colon's case, it's going to carry stool. In your small intestine, it's going to carry, it's going to eventually turn into stool, but it's starting to pull all the nutrients out, but those are tubes. So they cut out the bad part, reconnected the tube to the rectum. The rectum is also a tube. But that site where they reconnect is called an anastomosis. And a typical complication of an anastomosis is stricture in ovarian cancer cases. Common is stricture. Stricture is a narrowing at the site of the anastomosis. So instead of it being like this, it might be like that. Instead of like this, it might be like that, like teeny tiny little hole. And they get worse over time. And last year in the spring of 2022, I had a barium enema to check for strictures, did not find anything. So here we are at the colonoscopy. I find out I have a stricture at the site of the anastomosis. I didn't know it was at the site of the anastomosis, but I kept asking everyone throughout my stay, and no one could answer my question, which was very frustrating. Because it's like, this is what you do, shouldn't you know? And then, so I go back to my room. I didn't see any GI doctors that night, didn't see any other doctors that night, so I already knew that I was going to be in the hospital for another day, just because no one came to follow up, and I already saw everybody for the day. So in the morning, I was put back on a regular diet right away, and I ordered food directly from the recovery area of the procedure, because it was getting close to 7 p.m. when they changed the menu to like very restricted items. So I ordered my food, and then I go upstairs and, finish my night. I ate some dinner, whatever. And then in the morning, ordered a normal breakfast, and the hospitalist came to talk to me, and I told her I was annoyed because I don't know what's going on, and like no one can answer my questions. And she read the report to me, and she said that they could not use an adult scope for my colonoscopy. They had to use a pediatric one because the stricture was so small. But they did find that all of my tissues in my colon were normal, so no ulcerative colitis. She did not know if the stricture was at the site of the anastomosis because it wasn't written in the report. So then a gastroenterology nurse practitioner comes to see me, and she goes, yeah, they're going to want to stent you. I was like, you can stent a colon? I didn't know you can stent a colon. And a stent is just, they're going to put something in there. She told me they have permanent ones that were metal, and then they had semi-permanent ones that were more like plastic, and they would decide in the moment what I was going to get. But a stent is when they put something in the tube to pop it open. A lot of times you'll see those in cardiac patients, for people that had occlusions from plaques building up in the arteries. So they'll go in and pop it open. Some of the stents are medicated, etc., but that's in the heart. In the colon, they just go in and pop it open and, leave some kind of apparatus behind to keep it popped open. And I said, well, is the stricture at the site of the anastomosis? And she was like, yeah, I'm not sure. And I'm like, okay, I feel like you should know this. And then I said, what did I say? Oh, is this related to ulcerative colitis? And she was like, it probably is. And I was like, you can't even tell me if it's at the site of the anastomosis, because the reason I'm so fixated on is it at the site of the anastomosis, because that's a surgical complication. If all of my tissues appear to be normal and it's not at the site of the anastomosis, then I would think that would be more like inflammatory bowel disease, because you can get strictures from inflammatory bowel disease like Crohn's or colitis. So that's why I was fixated on it and why I wanted to know. But she was saying, yeah, I think it's probably UC, but that was not true. And then later on that night, another doctor came to see me from the GI team, and she said, you're not getting a stent. And I'm like, well, whoever came to see me this morning told me that I was getting a stent. And she's like, no, they're just going to go in and do a balloon dilation. So in the tube, they'll stick a balloon in there, they'll measure the pressure, and they'll try to pop it open that way. And she said, but you're at increased risk for bowel perforation and bleeding because there's an ulcer right outside of the stricture. So you have this hole, and then right outside of the hole, there's like a little ulcer there. And I was like, well, dang it, like, now I'm freaked out. I don't want to have a perforation and all of that. So got put back on a liquid diet. Had to do some more bowel prep and prepare for the next day. So the next day comes again. It's like later that I end up having this. And I asked to speak to the doctor performing the procedure before, because I was like, no one can tell me if it's at the site of the anastomosis. And so he answered that question for me, and he did tell me also that with these strictures, they'll go in and they'll balloon dilate them gradually. So I'll get one today, and he's like, we'll likely have to repeat this in phases until we get a good dilation for you. And what they do with the dilation is they go in and they take that very small hole and they break it. They cause an injury and let it heal. And then the next time you go in, they'll break it again, cause an injury, and let it heal. But you have to be careful breaking it because the ulcer is right there. So I go in and he does that, and I get out and I'm like, ow, 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 so much pain down in my rectum because of the balloon dilation. And they gave me some medicine right away that helped a little bit, but I ended up getting dilaudid when I went up into my room, because I was like, it still hurts. And so that was that. And then again, put back on a regular diet, and they just, the next day they were like, just keep your stool really soft, drink lots of fluids, take stool softeners, like try to avoid pushing, like you don't want to ruin, whatever's going on in there. I have like a waffle cushion that I can sit on that takes pressure off of my body. I still, like today, I'm in a lot of pain because I can't seem to figure out how to get my stool soft enough. I'm already taking like 3 to 4 Senna every day, and it's just not working. I take magnesium at night. I can't take Miralax. I have issues with that. So I'm just doing my best. I just downed a bottle of magnesium citrate to make myself go to the bathroom because I can't get it out, and it's going to hurt. It's going to be really painful, and once it's over, I'll feel a lot better for at least a day or two, and I'll have some peace. But this is what it is. It's like horrible, then it's fine, then it's horrible, and then it's fine, and then it's horrible, and it's just like a couple days ago I was up all night, didn't sleep at all. It's just a lot. So yeah, I've been discharged, and I have my next balloon dilation in a couple weeks, and play this super fun game of being okay and being in lots of pain, being okay, being in lots of pain, and my body is just incredibly stressed. I'm super tired all the time, and I don't know. That's where I'm at. It's not a fun place to be. My lower back hurts really bad right now. My sacrum hurts, and there's nothing I can do to relieve it other than to go to the bathroom. And when I go in there, I can't go. It's stuck in there. So I drank that mag citrate. I'm going to get this out today, and it's going to be a long, sucky day, but I know that I will eventually feel better. I'll get some relief, but it'll be short-lived, and that's just where I'm at. It super sucks, and I've had a follow-up. I'm just writhing right now to try to get comfortable, and I know that I can't. I had a follow-up with my general practitioner because of my admission to they always tell you to follow up with your general practitioner. So I did. I saw him on Friday, and I told him I had started a leave of absence, and I was like, I don't know, like, should it be a month? I just put in a month because I don't know. I wanted to talk to someone. He's like, it's probably going to be more like 2 months. I'm like, 2 months? I was like, but if I feel better, I can go back early, right? And he's like, yeah. And I was like, okay, well, hopefully if we get dilated well enough, I can just go back to work. But I'm really grateful to be able to have a leave of absence. You don't get paid as much. I think you make about 75% of your income. Some other places it's like 60. If you go to long-term, and it's usually 12 weeks that you get. If you go to long-term absence, they usually are around like 50% of your income, and that you can do that for, again, it's going to have a restriction on how long you can do it, I think. But you only get like half of your income. So that's kind of where I'm at. Just waiting for this mag citrate to kick in so that I can just get this out of my body, because, So, one thing I forgot to say is I read his report, and initially the stricture, they said 10 millimeters, and what they do is they go in and measure it with a balloon. So it's like millimeters of mercury pressure. They measure that in the hole that is there, and it was 10 millimeters of pressure, and he was able to get me to 15 millimeters. And I read somewhere online like the average adult colon is like 50 to 60 centimeters, and we're at millimeters right now. So this is really bad stricture, and I feel awful that, I just felt like I was doing the right thing. I listened to my doctors. We did the barium enema, and that was something that I asked my doctors about in the hospital. I said, I did a barium enema, and they said there was no stricture. This was in the spring of 2022. And I said, is it reliable, the barium enema? And she said, well, colonoscopy is the best. So I had a test that might not be the most reliable for finding a stricture, is what I'm gathering from what was told to me. So the moral of the story is, if you've had ovarian cancer and it spread to your colon and you got an anastomosis, you want to keep your eye out for stricture. I could not sit on my bottom. I was constantly having pain, like rectal pain, like pelvic floor pain, all sorts of pain, and I'm like laying on my sides, and I still can't get comfortable. And I would push for a colonoscopy. That's what I would push for. If they brought up barium enema, I would just say no. I want a colonoscopy because I think I have had this for a very long time. I've had pain since the surgery. And initially I was like, oh, it's healing. The anastomosis is healing. Oh, I have really bad constipation from chemotherapy. After the chemo was over, I'm like, well, it's still here. And we checked for anastomosis with that barium enema. At that juncture, if you're still having pain after chemotherapy, I would ask for a colonoscopy because you might be developing a stricture. And trust me, you do not want it to go as far as mine did because it freaking hurts. It hurts, cause me goosebumps, it would stop me in my tracks. It would completely take over my thoughts where I couldn't think well or communicate well sometimes. Trying to be with patients and just being dying inside and trying to maintain a helpful, I'm here for you face. Super difficult. And I only did that because I was following what my doctors told me to do. So sometimes you just have to push them a little bit further, and this is how you would do that. All right, that's my story. Super long. Sorry. But that's what's happening. And so I got several more weeks of not being comfortable and probably up all night, tired, kind of a thing. So here we are. Like I said, it's not necessarily over yet. And everybody have a good day. Make the best of it. That's what I try to do. I try to make the best of my day. This does suck, but I'm still going to try to make the best of it. And I am crying out to myself in frustration and things like that. But I know on the other side of this magnesium citrate, it's a laxative that you can take. You drink, it's gross. It doesn't taste good at all. Get a straw. Yeah, I just know better is coming. I'm glad we know what we're dealing with finally. So that gives me some hope. As far as the ulcer, they're not doing any treatment for it. They're just letting it heal on its own. Why does the ulcer exist? Because stool couldn't pass through very well. It just sits there and breaks the skin down. So that's why I even have an ulcer. That's probably where the blood loss came from. I have no idea. But I have follow-up labs to make sure I'm, maintaining my hemoglobin. I have some follow-up labs next week. So that's where we're at. Everybody have a great day. See you later.